I didn't think I was going to get this one out, guys. I got to be honest, this was my match. This is probably the toughest wax removal I think I've ever done. It was just really, I didn't think I was going to get this out at all. I was about ready to give up on this particular wax removal. It beat me. My speech barber, one of the audiologists, he had audiologists, so I don't say that because very often, but you can see in this particular case, we've got this really tough piece of wax here. I've tried to standardize on the tube. It just didn't touch it whatsoever. So we've got the St. Bart's hook in here. Now this is a long video, guys, so you might want to grab yourself a cup of tea, a cup of coffee, and come back to this one. I'll give you a little bit of background to this patient. This lovely guy came through, and he's actually a patient that we've seen before. He's had a mastoidectomy, which are never easy removals to do, but he normally comes through every 6 months, but just because of personal circumstances, he hasn't been able to get here for about 2 years. So we've got very old, very dry. You can see just how dry this is. Keratin and wax mixed together, which makes a really tough removal to do. So you can see this is just bone dry. Now I'm just clearing up this section here. Now this was relatively easy. Now I thought this was going to be sort of one of the tougher ones, taking a look at this wax removal, but it's the second ear canal you have to have a look at, guys. It just brutal. So we're taking these bits where you can see just how dry this canal gets, and this section here at the bottom is basically welded against the canal wall. I'm trying here, you can see that the suction tube is just literally scraping and skipping off the surface. The wax in there is just super duper dry. So I popped some olive oil in, and you can see the difference the olive oil makes straight away. Now you're going to ask me, why didn't the patient use some olive oil before they came along? Because when you've had a mastoidectomy, I know it wasn't this particular ear canal, but this patient's had the advice to always keep their ears lovely and dry, because when you've had a mastoidectomy, you're actually removing, part of the mastoid bone, which is that hard bit you can feel just behind your ear there. It's not a spongy bone, but it's an air-filled bone, lots of air bubbles in there. So basically, if you've had that removed, if you get water in there, you are far more prone to infection, and it can sometimes be really uncomfortable as well. So we managed to clear the first ear canal, and now I've come across this, so we can see that shelf. If you look to the right hand side, so you've got the ear canal that kind of slopes up and then plateaus off. That's the shelf. That's where they've removed part of the mastoid bone there. And what we can see here is we've got this really hard, dense skin layer here that I'm working on, and just trying to remove that. Now, when you have a mastoid cavity, you should have it checked about every 6 months, just to keep it nice and clean, get rid of all the skin, because we talk about epithelial migration. I talk about this a lot on the channel, but it's that movement of skin from that deepermost part to the outermost part of the ear canal. Well, if you imagine, if you're traveling down a tube, which is what most people's ear canals normally look like, then that can travel away really easily. But what happens if you branch off the tube and form a much bigger cavity? That's got to migrate around the cavity and come back out, which is going to take much longer. So you end up with this much drier, denser skin, which is what we have here. So it's skin that's older, it's dried out, it's got a higher concentration of keratin compared to how it did when it first was first developed. So what you've got now is this really thick epithelial skin layer that is hanging on for dear life in here, and you can see just how tough this is. I'm trying to pull this with a suction tube, but the suction tube just can't hold on to it tight enough. It's a really interesting one. Make sure you stay tuned for the end of this one, guys. It is such an interesting case, just because it was so difficult to do. So we've managed to pull that little bit of skin away. Let's see if we can peel the next section. There we go. So we're peeling this next section down the canal. There we go. Look how that is pulling away from the skin. We haven't actually got to the fresher skin underneath yet. This is still a keratin layer. So we've got layer upon layer of dead, dry skin. And that's before we work on the section to the bottom left of the screen. Now that section is covering the eardrum. So we've got all this keratin in this actual mastoid cavity, which is what you call that part where you've just removed all the bone. But we've also got this really dense section of wax and skin, which is covering the eardrum, which is the bit that was an absolute nightmare to get out. It was so difficult to remove. And you're in this sort of quandary. Well, what do you do with this patient? We said at the start, your patients can look at that, look at that, look at that, give it away. Just immense layers of skin. That's a lost train of thought again. I get so excited watching these videos. I go off on tangents and I can't remember where I was, but I went off tangent. Yes, sorry. What do you do with this patient? Because we've already said at the start of the video, they can't use olive oil. So if you send the patient away, they can't use a wax softener. So it is just a case of trying to chip this away as much as you can. You can pop some olive oil in while you're suctioning, because you're going to be suctioning the oil straight back out of the ear. So you can do it that way, but you can't ask the patient to go away and let the oil sit in the ear canal. That's the big difference, really. So we've pulled this top section. Now I can see straight away as I pulled this down, there's this thick, softer layer of skin that's sitting behind this, which means that you've got this hard layer at the front attached to this thick, soft layer behind, which is usually in turn attached to the skin and the eardrum beyond that. So you've got these three kind of layers, which are all, imagine they sort of compressed together and holding on to one another really tightly. So what I'm doing here is trying to peel. I'm trying to fold this plug down. There we are. I've got this actually the fine end here I've got. So just trying to peel down. There we go. You can see these layers starting to tease apart. Now at this point I thought, great, this is going to peel away really nicely. We can get this out really, really easily. But no, unfortunately not. So we're still trying to peel this top section. And as much as I'm trying to pull this down, it is hanging on for dear life. Now, there are two things you have to be really conscious of when you're clearing a mastoid patient, okay? The first is that they're going to be ultra sensitive, okay? You've got to be really, really careful down here, just because you've got to be careful the structures don't look as they normally would do in an ear canal. Everything's going to have lumps and bumps everywhere. There's going to be scar tissue. Eardrum's going to look very, very different. The other thing you've got to be aware of is the patient is far more susceptible to something called the caloric effect. Now, the caloric effect is if we have an extreme temperature change, don't forget, let's backtrack, sorry, a little bit. Your balance system, the innermost part of the balance system, you have your three semicircular canals, which tell you so which way your head is in, what position your head's in, but they're filled with fluid. Now, if we drop the temperature or increase the temperature too quickly inside the ear canal, that fluid changes in viscosity, so how runny it is. So if you make the fluid much colder, it becomes much thicker, so much more sort of gloopy. If you make it much warmer, then it becomes much thinner, so far more runny. And that effect the effect that has is it can make us feel really, really giddy. So you're always kind of looking at, well, how long am I in here with suction? You know, do I need to give the patient a little break? You know, you will come out of the ear canal, and I'm always checking with the patient to make sure they're doing okay. Now, the other thing we can see, look just below the suction tube to the left-hand side, you'll see the skin, it looks slightly different. It looks a bit mottled. Now, that's actually a piece of dead skin. And when we start to pull that forward, you'll actually see that that had a little bit of a blood supply to it. So when we take this out, that dead skin comes away, and there is a tiny little bit of bleeding just underneath. But that's just because this has been hanging on to everything so tightly. But we don't want this to stay inside the ear canal because it's going to cause far more problems. Not so much hearing issues, because the patient actually doesn't have a lot of hearing left in this ear canal, in this ear. But you don't want this skin just hardening up, because it can cause all sorts of different issues as far as the canal is concerned, and you don't really know what's going on behind it as well. So we're pulling this section. It's very dry, it's very crumbly, it's coming away nicely with the crocodile forceps there. But watch as we start to pull this from the side, we can see that it's just so hard. It just doesn't want to budge. I've got a bit of movement to this top right section. I can't get any lift from the bottom here. It just doesn't want to budge. So I'm just holding on to sections and making these circular movements just to pull them away. Fingers crossed, hopefully far enough away from that main bulk of plug to be able to grab them with the crocodile forceps. But look at this. Just so difficult to remove. So forceps again, back in. Now, by this point, I am starting to think, I don't think we're going to get this out today. Every time I get a grip on it with a forceps, you can see what's happening. It's just kind of breaking down ever so slightly, peeling away but not pulling the main bulk of plug out with it. It's just crumbling that surface section. And there you go, look, I'm folding forwards again. Now we can see, look at that section to the bottom left, that kind of mottled section. You can see that the wax and skin is starting to harden around that. And as I start to pull that, we do pull it in a second, I've got a little gap at the top, so very, very carefully here, we go in with the St. Bart's just to try and roll. I'm trying to roll this plug. There we go. Now you can see I'm pulling away. I can get behind the top edge. There, look at that. Now we've broken that top section away. Watch what happens here. Look at that section to the left-hand side, just below the St. Bart's hook. Dead skin. Look how all the skin is starting to die as that's gone around it. It's kind of really holding on to it. We've got this kind of sluffy, dead skin there that's come away. It almost looks a bit like a polyp, but it's not quite a polyp. So this is why we have to get this plug out, because you've got all of this going on with it as well. There we go. I was really hoping we were going to pull that, and just with the integrity of the plug, it was going to pull the whole plug forwards. We've loosened it. We've got some away from the eardrum here, but it's just solid, absolutely solid. So I'm going to go in with a forceps now. Let's lift this section. Not quite. Now lift again. It's almost there. You can see this little bit of movement. It's coming, but it's just, that's not what we want to see. It just broke away at the end there. And let's pull this section. There you can see I'm trying to tease it away from this right hand side because it looks really firmly attached. What makes it difficult is we've got almost this sort of, it's almost like a kidney bean, but it kind of narrows at the bottom shape to the canal, and it kind of opens up again just as it gets to the eardrum. So you've got this really solid plug that's sort of what would normally be your kind of recess there. It's all kind of dried in there and then hardened onto the skin. But we are getting bits away. It's coming away in very, very small portions, but it is coming away. Let's see if I can pull this top section down. Now, I've lost the ability now to get behind this with a St. Bart's hook. We managed to do that because we'd folded the whole thing forwards. And as we fold it forwards, what's happening is we've created a little gap behind it, which we could get behind with the St. Bart's. But the rest of this is right up against the eardrum. So we can't get behind it now again. Such a tough old job. Let's give this a little bit of a wiggle. You can see as I'm trying to hold on to it, it's just such a difficult consistency. There we go. I'm going to try now and lift from the bottom section. So I've got rid of the top. So if we can lift, we can bring this up and out of that recess. But I can't get a grip. It's so solid down there. I just cannot get a grip. And you can see as I'm pulling this, look how it's detaching, sort of stretching that surface epithelial layer, that really tough old sort of keratin layer. It's pulling it apart as we're getting to the top section there. Let's go on again, crocodile forceps. Not quite, not quite. Let's give this a little bit more. There we go. I'm trying to lift from that base section. But look how it's attached to the canal wall there as well. There is just nowhere at the moment on this plug that I can get any kind of purchase here. It is wedged. So by this point, I'm thinking, okay, I'm going to have to get this patient back in. But before I do that, I'm going to have to leave myself something to work on ready for next time. So I'm going to have to just loosen it a little bit and then sort of draw pieces off so I've got something to work on straight away. But before I do that, I'm just going to throw a little bit of olive oil. I will suction it back out, and I'm just going to try and lift this bottom section. Let's see if I can just get a little bit of olive oil underneath there just to loosen it off this keratin section. Look at this. I was really hoping it would sort of penetrate in and just underneath the skin a little bit. Look at that, it's just not folding forwards at all. I've just broken another section away from the top. And let's hold on to the side. No. Honest to goodness, guys, my arms were in bits. My shoulders were in bits. I was just broken by this point because my arms were up here for about, I think altogether, I think we were working on this for close to about 20 minutes, which doesn't sound like a long time, but you hold your arms up there for 20 minutes and make tiny little movements with your fingers. It took for like forever, but there was a tiny bit of light at the end of the tunnel. Look at this section here to the left-hand side. So as I'm lifting here, we've got this slightly softer skin that's underneath. But look, look. I turned it. At this point, I'm thinking, okay, all right, my reputation is intact. I can get this out. So as we've turned it now, we can see all that dead layer, that softer skin layer that was holding everything in place. But look at this. Woof. It's a beastie. Out that's come. And let's take a little look beyond that. So I'm just going to peel some of these dead skin layers away. Now I'm right into the cavity here again. All right, I'm just taking these dead bits of keratin, dead skin, old skin out of the cavity. There we are. I made the patient promise they would come back every 6 months to get this done moving forwards. And then we'll just get these last couple of pieces away. When you take a look at the eardrum, now obviously there's going to be a lot of scarring there. It's not going to look like a conventional eardrum. There we go. And there was that, you can see that recess I was talking about all the way around the edge. And that's where it was anchored into place. But yeah, although it doesn't look particularly healthy, that eardrum, it is much, much better. That's how I would expect it to look after a mastoid cavity, but looking so much clearer. Oh my goodness, that was such a tough one to do. 2 inches, 5 centimeters worth of keratin and waxing, guys. If you enjoyed this mastoid cavity removal, they are always good ones. I'll put another one up there for you so you can have a little look at that one as well. So make sure you check on that one. Take a little look at it if you're watching this on YouTube. And if you do enjoy the video, guys, don't forget you can always like, heart, share, follow, subscribe for me. And if you have ear problems yourself, then make sure you check out the link tree in the description. Come along and see myself or the lovely Mr. Taylor Green, and we'll get that sorted out for you. But as always, guys, take care of yourselves, take care of your ears, and take care of one another. And I'll see you again real soon. Bye.